just to kind of situate us as of last night where we are with the outbreak. We're at more than 80,000 cases worldwide. The deaths are nearly 2,700, 34 countries, and in the last 2 days, 5 more countries in the Middle East. So that seems to be the kind of the newest spread areas. So I wanted to start first with a question that's likely on everybody's mind, and that's about how worried we should be about the virus. You said a few weeks ago, you published an article in The Lancet saying that the next few weeks will be critical in determining whether containment is going to be feasible and a realistic option. We're now a couple of weeks on from that, so here we are. And what's your assessment now?
Well, those weeks have been very valuable to better understanding of this outbreak. You know, what you don't see is behind the scenes solidarity of doctors who are treating patients around the world at these outbreak sites, epidemiologists who are containing the outbreaks in countries, hoping to delay the onset of major outbreaks in their own countries, and also virologists who are looking at the virus, and modelers who are taking all that information and helping make projections. So all these things are going on behind the scenes and providing to us a really important understanding of this virus. What's always important at the start of an outbreak of a new virus or any infectious agent is not what's known as much as what's not known. And what's not known is the destiny of a virus. Will it just cause a few cases, an outbreak, and then disappear into nature, come back again? Or will it continue to spread in human populations and become endemic, as has HIV, for example, or other infections? So we're right now at a stage where we're beginning to understand that, how that virus will end up, but we can make really no solid predictions. But the evidence has told us a lot, and this is, again, from this solidarity in the world of sharing information. We know that this outbreak is caused by droplets that contain virus that pass from human to human, either through close social contact, a cough or a sneeze in the face or nearby, and also causes severe risk to health workers who aren't protected properly. The severe risk is even greater because, unlike for influenza, health workers have no immunity, as none of us do, for this new virus. Whereas health workers do have immunity for flu, they've had vaccinations many times, and they get a less severe form of the disease. So this new virus is quite vicious in health workers who have a very high inoculation of virus when they're taking care of patients. So we know the way it's transmitted. We understand a little bit about the seriousness. That's been skewed because initially all that was reported were serious infections, but now it's beginning to become clear that maybe up to 80 or 85% of infections are very mild, like a common cold, and others require some extent of hospitalization, and very few, fortunately, go on to death. And this is mainly in people who have comorbidities, pneumonia, diabetes, heart disease, other comorbidities, and especially for the elderly. So we're beginning to understand a lot about the disease, but what we don't yet understand completely is what's called the reproductive number, or the transmissibility. How easily does this virus spread from human to human? So far from the data in China, it looks like about 80 to 85% of all cases in China were in family clusters, close family contact. So the question is this going to spread elsewhere, and how will it spread in the future?
And globally, is containment still on the table? Are we still gunning for that, or should we kind of adapt our expectations now?
Well, containment to delay the onset is very important wherever there are outbreaks that can be contained. Because if you can stop the chains of transmission in those individual outbreaks, you decrease the chance that that virus will seed other outbreaks in the country to almost zero. So containment activities, such as have been done in Germany, being done here in the UK and other countries, do interrupt transmission in the chains of transmission from people coming into the country, and hopefully they delay the onset if this virus is destined to become widely spread.
Okay, I want to talk about the P word. That's the word on everyone's lips this week, pandemic. And I know you've said that getting hung up on the terminology is really a distraction, and that view's been echoed by experts at WHO. But nonetheless, there's a lot of interest on whether this should now be called a pandemic, how close we are to that. There seems to be a few opinions bubbling up as to why, now that we have these worrying outbreaks in Italy, Iran and South Korea, that it's not been called a pandemic yet. I wanted to ask you, how close do you think we are? And is it inevitable? And what the criteria are for a pandemic?
If it had been declared a pandemic, we would be doing nothing differently. The idea is to stop outbreaks if you can, discrete outbreaks, and interrupt transmission of those chains of transmission from an infected person to another, and at the same time prepare using pandemic influenza preparedness plans and others in the event that this does spread more widely. Some countries are already using some of those strategies. China has shut down major events. There was an event that was shut down in a sports event between UK and Italy that was shut down. Countries are beginning to use some of those strategies that are called mitigation strategies. And at the same time, they're preparing hospitals for the massive influx of patients that could occur should there be an outbreak that's generalized within a country. So there is a lot going on now, which is both strategies for outbreaks and for more widespread. I will continue to say that pandemic is a distraction because people are waiting to hear the word but don't know what it means. And I don't really know what it means either. But I do know that countries must continue to do what they can, and it's based on a national risk assessment, as is being done here in the UK on a regular basis.